Welcome to part 2 of It Takes a Village. In this segment, we will review many aspects of developmental screening. Developmental screening, just like developmental awareness and promotion, involves all young children. The type of screening tool used and frequency of screening depends on the age of the child, as well as the preference of the early care and education program or pediatric primary care provider. Each screening tool has its recommendations for best practice that should be followed. Developmental screening is a brief check to tell if a child is learning basic skills when he or she should, or if there are delays. A developmental screening takes just a few minutes to complete with a simple screening form. There are a number of developmental screening tools, but they share a common purpose: to make sure that a child is on the right developmental path. A developmental screening is not intended to diagnose a child, but rather to use observations and developmental milestones as a means to identify concrete concerns about a child's development. It is key to establish relationships with families first and empower their awareness of development and how they can promote optimal development in their children. This message will ideally be embraced and practiced by ECE and healthcare providers. One way this happens is to provide developmental information at the initial visit and periodically throughout the year, as well as implement regular developmental screening practices. The overarching message communicated to families is that intentionally doing things to promote development is good for all children. Several nationally recognized professional organizations strongly recommend developmental monitoring and screening for all children during the early years. Caring for our children includes evidence-based standards to ensure healthy, safe, and developmentally appropriate early care and education. It recognizes the importance of parent engagement and consent for screening conducted in early childhood programs. Head Start performance standards require that within 45 days of a child's entry into a program, the grantee must perform age-appropriate screening for developmental, sensory, and behavioral concerns and assist families with services if needed. The National Association for the Education of Young Children includes developmental screening and monitoring among emerging criteria for accreditation. The Connecticut Office of Early Childhood Licensing Regulations require that early care and education centers, including Head Start programs, have a health consultant who must be a registered nurse, nurse practitioner, physician, or physician assistant. As you can see listed here, the schedule of health consultant visits is determined by the ages of the children enrolled in the center. ECE centers are also required to have an education, social service, nutrition, and oral health consultant. The Early Childhood Consultation Partnership is available statewide and provides free early childhood mental health consultation services to ECE programs on an as-needed basis. In collaboration with families, healthcare providers, and ECE providers, health consultants can play an important role in facilitating developmental monitoring and screening. Just about 100% of children receive health services during their early years from pediatric healthcare providers. In fact, they cannot attend licensed child care unless the health provider first ensures that they are healthy enough to attend group care. Child health services present a great opportunity to monitor children's development as well as screen children for behavioral and developmental delays and risks. Child health providers see children several times in the first years of life, and they establish long-term relationships with children and their families. This continuous relationship informs developmental monitoring and encourages families to ask questions, express concerns, and learn about development. The American Academy of Pediatrics urges all child health providers to implement ongoing developmental monitoring and to screen for risks and delays. The AAP recommends that child health providers employ developmental surveillance at every well child visit. Developmental surveillance includes soliciting parental concerns, maintaining a longitudinal record of the child's development, finding out about how others view the child's development, and noting the child's strengths. Child health providers are also well positioned to connect children and families to helpful services when there are concerns. All young children should be enrolled in a healthcare home, that is, a pediatric or family practice which provides the AAP's recommended well child visits and comprehensive care. During the first 5 years, children should have at least 12 well child visits. At each visit, the healthcare provider should prompt a conversation with families and review developmental milestones, such as sitting, walking, and babbling, at each one of those visits. The AAP also recommends that screening be conducted at 9, 18, and 24 or 30 months of age. One way that child health care providers can inform the discussion about an individual child's development and behavior is through communication with the Early Childhood Health Assessment Record, or the Yellow Form. All children attending licensed early care and education programs are required to have a completed health form on file. The health record is a good way for the family, child health care provider, and ECE provider to communicate important health information and ensure that they are on the same page in meeting the child's needs in the ECE setting. Families complete the first page of the record, on which they can note any concerns that they have. The child health care provider reviews the parents' responses on page 1, completes page 2, and then adds immunization information. Page 2 asks providers specific questions about developmental and behavioral issues that could impact participation in childcare. It also asks about developmental screening. In 2015, the Connecticut legislature passed a bill requiring child health care providers to note on the health record whether or not they completed a developmental screen. Hopefully, this legislation will help increase the accuracy of the health forms submitted to ECE centers. When center-based ECE programs find that health forms are incomplete, they can work through their health consultants to provide completion and enhanced sharing of information between the child health care provider and the ECE center. Second only to the immediate family, childcare is the context in which early development unfolds. Since approximately 12.5 million children are in early care and education settings, these programs are key partners. Some of the valuable services they provide include sharing observations and screening results, providing referral information and support, communicating and collaborating with service providers, individualizing curriculum to meet a child's developmental and behavioral needs, empowering families, and advocacy. Understanding the purpose of developmental screening and the appropriate tools for this process is important. Since developmental screening focuses on developmental milestones and concerns and provides information about the need for further assessment, it is most accurately viewed as one component of a comprehensive assessment system and must be differentiated from other assessment processes and tools. Developmental screening information is used to determine the need for further assessment and incorporates the following features. First, they are appropriate for any setting. Secondly, they be completed by families, pediatricians, or early care and education providers. And finally, they are brief norm reference tools. This diagram illustrates the process of developmental screening progressing along two paths. When screening indicates no current concerns, then ongoing monitoring using a formative assessment process or regular screening is appropriate. A formative assessment process considers children's progress toward early learning and development standards, which address the broad scope of what children should know and be able to do. The information collected guides how adults support children's ongoing growth and development through curriculum and instruction. It is an ongoing process, best done in a systematic way using standardized tools. If screening indicates a need for further evaluation, then a diagnostic evaluation is completed with an assessment tool. This process compares each child's abilities to standard developmental expectations or looks deeply at specific areas of concern. It is designed to provide more specific detailed information or to determine the existence of a developmental delay. For children with identified needs, connection to services is the next step. Birth to 3 or early care and education providers may work with families to identify priorities and to develop goals. It is important to find the right screening tool to fit the children in your care and the staff that will be administering the tool. Provide staff on standardized administration, scoring and interpreting results, and how to share that information in conversation with families. Provide information for families on developmental screening activities, such as what, why, how, when, and where it will be completed, their role in obtaining an accurate picture of their child's development, and what to expect from their follow-up conversations with ECE providers. Establish a protocol for monitoring completion of developmental screening activities. Regularly notice successes and areas for improvement. The intent of a policy is to demonstrate that an early childhood provider is committed to partnering with families to ensure positive outcomes for children. It supports the program's commitment to work with all families to engage in ongoing developmental monitoring and screening, as well as identifying potential delays early so that appropriate supports can be put in place. It is best to inform families of this policy and practice from the very beginning of their child's enrollment. This includes reviewing the policy with families and placing information in the parent handbook. Give families the choice to opt out if they prefer. After the policy is developed, implementation can happen systematically. A developmental monitoring and screening practice helps providers to have a more formal way about approaching observations of young children. It is important to first determine practices that can be integrated into your program by reviewing checklists and developmental screening tools. Then, use the guidelines and recommendations given by the screening tool you select. Next, solicit feedback from teachers and parents on how they use the information, and then adjust as needed. Discuss with staff how to best incorporate new approaches into existing classroom practices. Review with staff how to share monitoring and screening information with parents, discuss concerns, and offer community resources. All screening activities can be supported by collaboration and regular communication among staff, encouraging family support and involvement, and using evidence-based tools. An invaluable resource called Watch Me is a free online training for early care and education providers developed and hosted by the Centers for Disease Control and Prevention. Participants learn why monitoring children's development is important, why they have a unique and important role in developmental monitoring, how to easily monitor each child's developmental milestones, and how to talk with families about their child's development. Although the type of screening tool and method of administration may vary, families should be informed in clear terms of the screening results and what happens next. If the child is meeting milestones, continue to monitor development and conduct recommended screenings. As part of the conversation, ask families if they have any concerns about their child's development. Also, offer resources such as Child Development Infoline and the CDC's Milestones Checklists and Milestone Moments booklet to promote their child's development at home. To ensure that every child has developmental screening and ongoing monitoring, parents and families, pediatric primary health care providers, ECE providers, and health consultants must communicate and work together to accomplish this goal. Thank you, and please visit the toolkit for more information.